business owners, and hopefully focus on topics that are important to everyone, which I know today's topic is high on everyone's list. So before we jump in, I did want to cover a few Zoom housekeeping items. If you can please remain muted for the entire call, that would be much appreciated. We want to make sure everyone can hear. And if any questions do arise throughout the presentation for our speakers, please feel free to put them in the chat box, which should be located at the bottom or side of your screen. And we will have a time at the end for question and answer. So Jessica will be monitoring the chat, and we will do our best to get your questions to our speakers. And finally, I did want to make you aware that this Zoom call will be recorded. So this morning, we are joined by Jim Rutherford, Kalamazoo County Health Officer, and Vern Johnson, Environmental Health Division Chief of the Kalamazoo County Health Department, to give us an update on the Michigan Department of Health and Human Services pandemic order and talk about the restrictions and protocols surrounding it. So we hope that they'll be able to share with us any information they have on the vaccine, which sounds like it will be getting made right here at Pfizer, which is very exciting, and how it is proposed to be distributed. So I will hand it over to them. Jim and Vern, take it away.
Good morning, and thank you, Kelsey, for that introduction. Joining us today is also our Operations Chief, Lindy Warner, who also serves as our Public Information Officer. So I believe, Lindy, you're going to share your PowerPoint presentation?
Yes, and actually, Kelsey, it doesn't say I have access to yet.
Jessica should be able to give you access.
Okay, you should be all set.
Perfect, thank you.
So again, thank you for the opportunity to allow us to join you this morning and give you a bit of a situation update. We've been working now on our response to COVID-19 since, gosh, we go back to February in my calendar in terms of some preliminary meetings. A lot has happened over that course of the last 10 months, and we've provided a lot of significant response to this global pandemic, and we'll continue to do that until we're completely done. So we'll start with the next slide, Lindy. So I know from a business and economic standpoint, this has had significant impact upon our businesses, in particular, some of the smaller businesses, as it relates to the many pauses or executive orders that have been, delegated by either the governor's office or most recently the Michigan Department of Health and Human Services. MIOSHA has also had some restrictions that have impacted businesses, but the most recent is the COVID-19 pause to save lives, which I'm sure you're all very painfully aware of some of these restrictions. What's open, and again, this was just most recently, this was extended and is set to expire on December 20th. We continue to ask the governor to be as proactive as possible as it relates to communicating what their next steps are in Lansing as it relates to extending these restrictions. Currently, what's open is obviously 2 households are able to gather, small outdoor gatherings with less than 25 people. Much of the retail is open, but there's some restrictions in terms of the number of people that can be in shops. Preschool through 8th grade is still open for face-to-face learning, although many of them are continuing to do remote learning, particularly around the Christmas and Thanksgiving breaks. Manufacturing, construction, and other work that's impossible to do remotely, including technical education. Our public transportation system is still open. Hair salons, barber shops, and personal services are open. Gyms and ice rinks, although ice rinks has changed recently. Pools for individual exercise, no group exercises can be undertaken. Restaurants and bars, outdoor dining only, takeout and delivery, professional sports without spectators. And we're working very closely with our athletic programs at Western Michigan University. Parks and outdoor recreations and funerals are restricted to no more than 25 individuals, and obviously healthcare and other essential services. So that leaves, what's not open, and high schools are all restricted for in-person learning. So grades 9 through 12 are remote only. Colleges and universities. So we've worked very closely throughout this entire pandemic with our K through 12 system, meeting with them on a weekly basis, and really responding to their needs on a daily basis. As you can imagine, the first semester of school has been real challenging, but we've got a lot of phenomenal school systems within Kalamazoo County that I think have done a really great job of implementing some of those mitigation strategies to allow them to have face-to-face learning. Colleges, obviously, we work with Western Michigan University, K College, and Kalamazoo Valley Community College. They've been great partners throughout this entire episode, really putting in a lot of time and energy to make their environments as safe as possible while still adhering to those executive orders and restrictions. Obviously, I think one of the biggest hits is on restaurants and bars for indoor dining. As you all know, this is just really problematic for those facilities that might not have a drive-through. The large chains like McDonald's and Taco Bell, Arby's, those all do fairly well because they have a drive-through. And even prior to this pandemic, probably for many of those establishments, their drive-through served as the, if not at least half, even greater than half of their revenue comes in from that drive-through system. Those mom and pop places are really the ones that are struggling, the places that serve maybe breakfast and lunch only, places that really haven't really been able to adapt to that, takeout model. Those are the entities that unfortunately are being hit the hardest. Organized sports, obviously, particularly within the K through 12 system, that was a pretty significant interruption for those school systems. Theaters and movie theaters, stadiums and arenas, they've really been hit hard, and not just with this pause. Prior to that, they were hit very hard in the beginning of this epidemic with the initial executive orders coming from the governor's office. Bowling centers, trampoline parks, and indoor water parks, same thing. Bingo halls, casinos, and arcades that are not affiliated with a Native American ownership. And then group and fitness classes. So a lot of moving parts. Again, a big part of what Vern Johnson and why he's here at this particular meeting is, he's really taken on the lead role as it relates to understanding many of the many executive orders that were involved with us in the beginning, and working with our businesses, working with our food facilities. It's a natural fit for his division in that they do all of the regulatory inspections, they do all of the oversight. So unfortunately, we've had a couple of restaurants that have decided that they're not going to adhere to the restrictions. So unfortunately, that brings about a lot of time and energy on his part and his staff's part to be able to address that. And it's a really unpleasant place to be, because we know a lot of these businesses are they're one bad day from being closed permanently. So it's a really tough spot that we're in right now. Lindy, you want to move on to the next slide, please? So one of the items that we continually are looking at, certainly at the local level, but also at the state and national level, and these are the key metrics that the state health officer, Director Gordon, is looking at when the state makes decisions in terms of, do we continue to put forth or extend these restrictions, or are we interested in lifting some of those? And really, the impetus for these restrictions is when we allow the disease to flourish within our community unchecked. And I know a lot of people say, well, we'll just get herd immunity that way. Really, it's difficult to get herd immunity without the presence of a vaccine that's readily available and that's taken by a lot of individuals. You have to have about 70% of your population immune to a disease to really get a handle on it. So not having that up until now, and we'll talk about that in a little bit, but not having that up until now, that's a pretty big public health tool that we didn't yet have in our toolbox. So we really have to rely on some of these mitigation strategies, or we're going to do things like tax our hospital system. And then when the hospital systems get overrun and they're not able to, provide some of the other services, elective surgery, when they're overfilled or overwhelmed within their emergency rooms, it becomes very challenging for a community to have, that level of disability within the health system. So it's important that we're constantly looking at the data and working with our health systems, which we do on a daily basis, to assure that they're in pretty good shape, which they've been, but it's been extremely challenging. And oftentimes we hear people say, well, why don't we just put some makeshift hospitals up at, Wing Stadium? And, while that's a great idea, and I think we tried that in the beginning of the pandemic, particularly on the east side of the state, the reality is we can't make more doctors and we can't make more nurses and all of those technical positions that play into having a successful health system. This is a workforce that is beyond overtaxed. And this has been going on now for almost a year for many of these individuals. So it's not as simple as just, providing some makeshift health systems if you don't have the ready and trained and fresh staff to be able to house that. So what we're looking at and what we've been looking at for many, many months now are pretty much three simple metrics: the percent of beds that are occupied by COVID patients within our health systems. And again, these are measures that are impacting hospitals. It takes time after cases decline to show improvement. So it's not as if we do the mitigation strategies and the next day we start to see improvement. It takes time. And, typically it can take 2 weeks for us to employ a strategy or have something happen. And I'll use Thanksgiving as an example. If we see that people, are not adhering to those mitigation strategies, and they're just, not avoiding one another, they're not wearing a mask, they're not distancing, they're not taking those precautions and utilizing those, then we can see that. But again, it can take up to 2 weeks or longer to really see that impact. The next mitigation strategy is the number of new positive cases per 1 million residents. And this is a direct measure of COVID-19 spread. And again, this impacts our hospitalizations dramatically. And then finally, percent positivity. How prevalent is COVID within the community? Next slide, please.
This is the part.
Go ahead, Lindy.
I was just going to say, this is the part that since Jim has reviewed what those key metrics are, you may be wondering, okay, where do we get that information? So I'm going to walk through just the data that we have. We do have our data hub that we host on our website, and this is the address. We can put it in the chat later as well. And then we also look at the My Safe Start map, and that is also statewide what is going on. So I'm going to stop sharing this screen for just a second and jump over and talk through our data real fast. Okay, so hopefully you can see the My Safe Start map. Maybe Kelsey, if you can just give me a nod. Okay, perfect, good. Okay, so this is what the state is looking at when we talk about the metrics. When we see the test results, this is that daily positive test rate. You can go out. I prefer the 6-month view just because I can see what's really happening here as far as what the trend is. But you can do 1 month, 3 month, or 6 month, or you can do the whole thing, which really puts it in perspective. But this is the test positivity rate, and statewide we're at 13.8%. And then the new cases, those new cases per million. This is what we're looking at whenever we look at that key metric. And again, you can see what the number is and what the trend is. When we go to, so right now, and this is something that I'm sure y'all are all familiar with, but we're broken up by different regions. And so our region is luckily called Kalamazoo region. So it kind of keeps it simple for us. But that sometimes can get confusing when the state talks about the Kalamazoo region and just knowing the difference between that and what Kalamazoo County So as a region, you can see that, and the region is made up of all of these counties right here, that our region is at 13.8% positivity. You can look at and see what that trend is. And then you can look over here at the new cases per million, and that's 503.5 daily cases per million. And again, you can see what that trend is looking like. I want to go specifically to Kalamazoo County because it's important to know what's happening in our region and what's happening with our surrounding counties, our neighbors, because we do have the regional hospital systems here. So what's happening with our neighbors does impact us, but also for Kalamazoo County Health Department, we're mainly focused on what's happening in Kalamazoo County. And so when you look at the difference here, as Kalamazoo County goes, our test positivity rate is at 11%. And you can see what the trend is doing. We're kind of going up and down in between that 10 to 15%. That 10 to 15% is a C range. Ideally we want to be at low, but we would be thrilled to get to just even A, to that 3 to 7%. And that's really where we were more during the summertime, was we were at more of that 3 to 7%. So right now we are just hovering in between that 10 to 15%. And right now we're at the lower end of it at 11%. When we go to next, looking at the total cases here, you can look and see that we are on a downward trend for the last about 2 weeks. The data is showing that we are on that downward trend. We are still, in that E category. I think what's important to note that even though we're seeing that downward trend, we are significantly elevated still with the number of cases. And so there is that positive news, but it's also very much caveated with, we are significantly elevated still, especially as we zoom out and we look at during the total pandemic here, where we were during the summertime and what has, occurred in the last couple of months here. I also want to point out, let me go over to our website. So there's a few things on our website that I want to point out to businesses. We do keep, in case you're wondering, how do I get to the My Safe Start map? We do have that information directly on our website right here. So you don't have to remember multiple website addresses. You can just remember ours if that's the easiest. And that's how you get to the My Safe Start map. But a couple of new items I want to point out is that we do now have our COVID-19 vaccine webpage, and that is where we have the information that we do know. That is where we're going to be sharing. So right now, a lot of that information is, as much as we know, and we'll be constantly updating that. We do have some frequently asked questions and some good resources. So even if you have employees that are asking questions about the vaccine, I would encourage you to send them to this page, and then that directs them to credible sources, whether that is the State Health Department or CDC. Another helpful tool is the quarantine and isolation calculator, and I am going to click on that just so that you can see. This is our hope to help with trying to figure out, how long do I isolate, how long do I quarantine, given the most common scenarios that we receive. So that I have tested positive and have symptoms, I have tested positive but have no symptoms, I am a close contact of someone that is not within my household, and then I am a close contact with someone within my household. And so we're hoping that these calculations help as just giving general guidance. We do want to make it clear that you should always follow the instructions from your medical provider and the state's epidemic orders, but that's a hopeful guidance tool that people can use when they're trying to decide, how long do I need to isolate or quarantine for. A couple other items I want to point out is the isolation release request form. So we know some businesses require that the employee present this before they can return to work. So we now have that form online. And then the other tool that we have online is the businesses reporting COVID positive employees. So we know that that is a requirement from the state, and previously, we were getting calls or emails with that information. We now have that tool online for you guys, so you can just go in enter it, hit submit, and it comes to our communicable disease nurses. So those are just a few things that I wanted to point out. And let me get back to our presentation here for Jim.
Okay, thank you, Lindy. This is our final slide, and we're wanting to allow some times for questions and answers. But really, again, we've been working on this for a very long time now, but there is a light at the end of the tunnel. And I alluded earlier to I think the strongest public health tool that we can have for a global pandemic certainly is the availability, the ready availability of a vaccine. And as most of you know, that vaccine was approved by the FDA for emergency use yesterday by the FDA. Today, the National Epidemiology Review Board called ACIP will be going over all of the specifics for the distribution of the vaccine within the United States. Obviously, the Pfizer product is the first product that has been approved for use in the United States, as of yesterday. So we're very proud that we have Pfizer right here in our community and excited about the availability of the vaccine. When I talk about how that rollout is going to look, I try to have people kind of look at an upside down funnel. Whereas in the beginning of this process, the availability is going to be relatively limited, and we have some very direct phasing that has been identified by the CDC and the state health department, which pretty much prioritizes the most vulnerable individuals at the top of the list for that availability of the vaccine. So we know that healthcare workers within our hospitals, our first responders, and most importantly, the individuals, the senior individuals that live in congregate settings and long-term care facilities, and congregate aged homes. This population has really bared the true burden of this disease, and that in Kalamazoo County, approximately 70 to or higher percent of our fatalities have occurred within this population, many of which are over the age of 70, have a lot of comorbidity, have a lot of pre-existing health conditions. So it stands to reason that these are the groups right out of the gate that need to get access to the vaccine. Michigan can anticipate a pretty limited supply. The first shipments will most likely go out as soon as this weekend. We could potentially anticipate having the vaccine in Kalamazoo County at those distribution areas by Monday. Both Bronson and Borges, as well as the local health department here in Kalamazoo County, have those ultra cold storage units. We're one of 12 counties in the state of Michigan that has been selected to be actually a hub for both storage and dissemination. So we have actually a couple of those ultra cold units that are available that can store approximately 175,000 doses. If you didn't have a chance to see the nightly news last night, there was a real nice story on Western Michigan University School of Medicine in terms of, that was, I believe, on NBC, or was it CBS, Lindy? I can't remember. I believe it was NBC.
Yes,
but,
I think he's NBC.
Very nice story about their preparation for receiving the vaccine and going into their facility. But it's just a lot of excitement, a lot of positive energy around the availability of what appears to be a very effective vaccine and appears to be a very safe vaccine as well. A big part of our role and responsibility moving forward is really educating the community as to the need to have the vast majority of our population utilize and take advantage of the vaccine in order for us to really turn a corner here and become immune to this and be able to get into a post-pandemic, which will take many, many months. When we look at the fact that they're still doing research on, younger children in terms of the efficacy of the vaccine and the safety of the vaccine, while the early research is identified as very favorable and positive, it's still going to take some time. So, kids 0 to 18 are really at the last of the list, but we would like to see, hopefully, objectively having that population vaccinated prior to the fall schedule for school, so we can, get back into that face-to-face learning. Teachers are pretty high up on the priority list for receiving the vaccine as well. So that's a lot of information for all of you, and we wanted to afford some time for some questions and answers. I don't know how you want to handle this, Kelsey or Lindy.
So I'm going to jump in. We had some questions that were brought to us prior that we wanted to put out. So one came in. I would like to know how to get on the list to receive the vaccine. My company is a medical group. We've reached out to Pfizer and MDHHS, and they have no information for us. So how do you get on the list for your business?
Well, it depends. It depends upon, what their eligibility would be. And if it's general population, then that's going to be months down the road. Again, this is a phasing in system with, the CDC identifying those groups that are the most vulnerable that I've alluded to. Mm-hmm. So there'll be time for us. And if we're doing our job right, then we're messaging well in advance of when that availability is. We do anticipate, and we're gearing up for smaller vaccine operations in the beginning. Those will get larger and larger. Our role is to vaccinate the first responders in the community. That includes EMS. Then we get into, police, fire, we get into teachers, we get into, those workers in essential services, meat packaging plants, places like that. So there's been a lot of thought and practice put into, how that rollout will continue. But people are going to have to be patient. And I'm pleased that there's such a desire for, a lot of people are interested in getting the vaccine and being able to put this hopefully behind us. But we'll do a very good job, and Lindy does a phenomenal job of educating our community in terms of the availability in advance, well in advance.
Awesome. Another question relative to the vaccine. So if you have had the vaccine, and we'll say, I think both of them it takes 2, right? How long until you are free of the quarantine requirements?
Okay, so it's both the Moderna product and the Pfizer product are a double dose. So you'll get 1 dose on one day, and then for the Pfizer product, 28 days later, you need to get your second dose. Once you start with one product, you have to stick with that product. So you can't get 1 dose of Pfizer and the second dose of Moderna. So we'll be notifying people when they get the dose. Initially, we'll give them a card. It'll tell them when they need to come back for their second dose. Immunity is going to take, if an individual gets 1 dose and doesn't get the second dose, obviously you have diminished capability for immunity. It probably is about 50% of what we want to accomplish or less. So it's important that second dose is administered. In terms of immunity, that's just going to take some time. I really don't have an answer to whether or not. I don't think that there's any quarantine that I'm aware of after receiving the dose. This is not a live virus, so it is relatively safe. They've encountered some reactions for people that have hypersensitivity to asthma triggers. So I think we'll learn more. And when we do testing of a vaccine like this, even though it was expedited, our role is to really explain that process and explain why it is safe. But there's going to be side effects for some people, some more than others. I use an example where my wife and I both received a shingles vaccine a couple of weeks ago. I had a pretty significant response to that, was achy for a couple of days, had flu-like symptoms, and hers were less than that. So you're going to anticipate that. Sometimes when people get a flu shot, they have some minor, side effects, but in the end, the vaccine side effects are much minimal compared to what getting the disease through regular transmission routes would involve.
Mm-hmm. Okay, so now we'll step back to if you haven't had the vaccine, but if you had COVID and a month later you were exposed to it, do you have to go through the quarantine process? So because you had COVID, are you immune? You don't have to do the quarantine, or do you? How do you like that?
No, once you've gotten COVID, and I'm assuming that's through regular disease transmission, person-to-person transmission, then you've got immunity. The science isn't, understanding enough to know how long that immunity exists. So I really can't answer. But most of the people that our recommendation has been, if you've got immunity, then you really aren't considered somebody that needs to go into beyond the initial quarantine. Or I'm sorry, the initial isolation. You wouldn't have to do anything beyond that. It is recommended at this point in time that if someone does feel that they have immunity, if they've been told that, through a positive laboratory test that they've had COVID, that they still should consider getting the vaccine.
Mm-hmm. Okay. And then the last question that I have, and then Kelsey, I think, is going to jump in. The MIOSHA or local inspections, are you doing inspections randomly with businesses? And if so, do you issue fines, or do you work with the business to help them overcome whatever the deficiency might be?
So I'm going to transition this to Vern, but I will say up front that MIOSHA does their own oversight, and regulatory, involvement is really not on our plate. But Vern, if you want to talk a little bit about what our role has been from a regulatory standpoint.
Sure. Good morning, everybody. So our role, so Jim is right. MIOSHA, they do their own inspections. Their primary focus is worker safety. And so when the governor issued the emergency orders, and now it's kind of transitioned into MIOSHA issuing their own directives for protecting workers, as well as Director Gordon from Michigan Department of Health and Human Services putting out the emergency orders. MIOSHA does their own, and again, they will do some random visits, but primarily it's complaint based. In fact, with MIOSHA, they're receiving so many inquiries that the first thing that they will do is will kick out a letter, and then they may make a phone call, may have to visit if the problem persists. What our role has been is primarily advisory. And so we want to make sure that our businesses, including our restaurants, are fully informed on the emergency orders. That quite honestly, because of the amount of COVID positive patients that and individuals that Lindy outlined, and how this has our numbers have from the spring of last year, we had a surge, then it diminished in the summer, then they've really picked up in the fall. When you look at those emergency orders, they've been changing. So we had a closing, then an opening, now we're at a closing again. One of our jobs is to try and keep folks informed, and small businesses informed in our community, of what those changes are. We meet with them, we take calls from them, we meet with our restaurants, and have throughout this pandemic, my staff, to really inform them of the requirements, and to help them safely navigate through the emergency orders, and so that they can remain open in some way, shape, or fashion. We don't issue fines, but we certainly do at times have to enforce these orders. Now, keep in mind that these orders are state orders, and so we involve the state agencies as well when we're seeing some major non-compliance. For the most part, what we've seen in Kalamazoo County is, when we bump into a non-compliance issue, is truly a lack of understanding of of the order. And so we want to partner with those businesses and those owners to help them get into compliance and do so without issuing fines or bringing out the regulatory hammer, if you will.
Awesome. Thank you, Vern. So here are some questions that have come up in the chat box. Is there a quarantine and isolation calculator that can be used by healthcare workers? I think what she's saying is they have different guidelines and situations than the general public.
Jim, I'll jump on that one. So the isolation and quarantine calculator that we developed is really just for that general guidance. I think other sectors, healthcare in particular, they do have different guidelines, different rules that they need to follow, and it just kind of complicates it a bit when we look at communication for the general public. So those situations, those are still, if people have questions, we still are answering those through our call center and also through our communicable disease nurses. So I would say those types of questions really should come to us or through the employer to us because there are a lot of particulars and there's just a very specific rules for that population.
Perfect. So obviously there's been elevated cases now compared to the summer and testing is more available. How is this factored into your analysis?
We do know that there wasn't the ready availability of testing, particularly in the beginning months of this. So, I think that certainly has improved. I am a firm believer that if you test more, you're going to find it more. So that doesn't really take away from, percent positivity is the true indicator of how prevalent this disease is within the community. So if I test 10 people and 3 of them come back, that's a 30% positivity. So those are kind of the I think the metrics that we use to make decisions, and really they're pretty pure, particularly the percent positivity and the number of hospital beds that are readily available. Again, we've had to transition a lot of beds that have historically been used for other services within our health systems and put them in as COVID specific rooms. And there's some work that has to go in to doing that as well. And again, it's not just always the availability of space, it's the availability of healthy staff to be able to address that. So we can endure a lot as a community, but when we start really hampering our hospitals, it puts us in a very vulnerable spot as a community.
Here's another question. What steps are being done to keep local health departments and stat levels on the same page with processes and guidelines, with processes and guidance on tracing, quarantine, release to work, et cetera, especially understanding the difference between healthcare workers and general public? So essentially, what are you guys doing to keep everybody in the loop and keep everybody on the same page is what I'm getting from that question.
So as it relates to contact tracing, I believe it's been, probably almost 6 weeks, but we've been very transparent. We partnered in the beginning with the state health department and tried to hire as many nurses as we could to do contact tracing, to do disease investigation. At any given time, I would have thousands of hours a week that we have delegated towards disease investigation and contact tracing. And we relied very heavily on the partnership with the state, who had many contact tracing individuals that they've contracted with. But at a certain point in time, we just were unable to keep up. And we've been very transparent about that reality insofar as we've really put out a lot of education to the community as it relates to people taking ownership of their positive notification, making sure that they're notifying people that may have been close contacts with them, explaining to the community what a close contact definition was, and then asking people to take the necessary measures to isolate if they've got a positive COVID test, and then individuals that are considered close contacts to quarantine for the length of time that was necessary. We've also, we've had to really hone in on a specific populations to continue our work with the resources that we have available to do disease investigation and contact tracing. Those are obviously people that are over the age of 70, people in long-term care facilities, our K through 12 system, people in congregate type environments, where, left unchecked, we can really have significant activity in a jail or within a long-term care facility. So even just those reduced responsibilities are overwhelming, coupled with the fact that, we're also have a very large lift ahead of us as it relates to preparing for these mass vaccinations to try to get, if we have a population of 260,000 residents in Kalamazoo County, 70% of that is probably, I think, about 165,000 that we have to assure that we get vaccinated. So that's not just on us, that's on our health systems, that's on, EMS, that's on all of the partners, but that's a significant amount of work ahead of us. And we've employed an incident command structure. Next week the county will open up their emergency operations center, and this will be months and months worth of many vaccine clinics, vaccine drive-through clinics, those mass exercises. So we're doing what we can as a system. Just like the hospitals, we do what we can with the resources that we have, but there's a lot of demands on our time and attention.
You may or may not have an answer for this question, but someone has asked, if a user of the vaccine has detrimental health impacts, how will that data be made available to the public, and will the producers of the vaccine, be held liable in any way? And I know the vaccine is still coming out, so I don't know if you have a response to that at this time.
Well, I think what we'll encounter is an immediate, in this day and age, it's difficult to not be transparent about anything, particularly when you're vaccinating millions and millions of people. You're going to see some side effects. You may see some things that weren't identified through the research process, but I think it's hard to hide anything anymore, particularly when you're involving the entire world in terms of the dissemination of that product. So I'm hopeful that we don't encounter any, significant unknowns or variables that weren't identified within the research of this product. I'm confident that the research has gone through a lot of science, and a lot of really smart people have been involved in this. Some of the smartest people in the world have been involved in this research project, the development portion of it, the oversight portion of it. So at some point in time, we have to have some faith and trust within our scientific community. And again, this is such an essential part of us being able to turn the corner. It's really important that we understand the safety and that people are willing to take the vaccine.
So with the holidays approaching, people may be in situations where employers are requesting that people join them for a holiday party or congregating groups of people. Where do the recommendations stand for congregation in terms of, say, potlucks or dinners or any sort of celebrations? Don't do it.
It's the same message that we had over the Thanksgiving period, that we're not out of the woods. The availability of vaccine is going to be, I would anticipate that we're well into 6 months of us really getting through all of the different priority groups. So, we can start taking little breaths after we get done with these populations, but the disease transmission is still going to continue. It's going to be lessened, but don't do it. It's just common sense that this disease is transmitted from person to person. So if we can reduce the likelihood of transmission, that's the route to take. And really, we're in the fourth quarter here. It doesn't make any sense for people to be taking unnecessary risks, to be not mindful of that vulnerable population. Even though we're rolling this out, that doesn't mean that 100% of persons over the age of 70 are going to be able to receive this right away. So we continue to recommend a conservative approach towards those gatherings, and people need to make good decisions moving forward.
Thank you for reiterating that. I think it's just a good thing to keep in the back of our minds. Have you been tracking the mental health impact of COVID-19 from the county level, or has there been any state level measuring of that with people isolating and all of the things that are happening this year?
Yeah, and we have, integrated services of Kalamazoo does a lot of the mental health work. So I think that I probably would encourage, that might be your fodder for your next meeting, is bringing in, a rep from ISK. They do a phenomenal job. We know that, this is challenging. It's challenging for everybody, in terms of the fatalities that we've encountered, in terms of having to adjust our lifestyle, and I think it's hard on kids. We're approaching the second semester of another class that is going to have most likely their graduation, their senior years are significantly different. I had a son that graduated last year, and it was just sad to watch what these kids are missing out on. We know that things like protective services reports on abuse are dramatically down, and that doesn't mean that it's happening less. That just means that the teachers that typically make those reports to protective services are not seeing these kids on a day-to-day basis. So we know that kids that are in vulnerable positions are even in greater vulnerable positions. We know that this is impacting people's livelihoods. We know that people are losing their jobs, people are losing their businesses. So when people say to me, "I'm not taking this vaccine," I scratch my head and say, "Geez, help me out here, folks. We really need to find the end of this, and this is a big part of that." So be mindful of what's going on as a whole, and we see crime rate is up in many cities. So yeah, it's challenging. Are we measuring that? We're not at the health department, because that's really not what we do. But I know that there's other entities that can probably provide a more informed discussion on that subject.
Perfect. Thank you. So here's another question from the chat box. 2 weeks ago, we were told due to increased cases, we were responsible for contact tracing, and the guidelines from the state and local level were very different. They are in the healthcare field. This caused several issues and concerns between employer, employees, and clients. Any advice to streamline this? And can you also discuss who needs to be doing the contact tracing and who does not in terms of industry?
Lindy, you want to take some of that?
Sure. So as far as, I guess the last part of it is, who is doing the contact tracing? As Jim said, about 6 weeks ago, not just our health department, but health departments across the state of Michigan had very similar messaging that, we are not able to, at this time, conduct the contact tracing with just our own staff resources, that we were at capacity. That same communications was with the state as well. So we were all very much in a line of communicating that we do not have those staff resources anymore. The number of cases and the number of contacts had increased exponentially. So with that, general guidance was given out. We understand that it is very complex at times as far as figuring out, who is a close contact, how long to isolate and quarantine, especially as information is coming in. So I think we all tried our best to equip people with that knowledge. It's also about setting expectations too, as far as the reality is that people have their positive status as being a positive COVID-19 person, and they were going to receive those results well in advance of the health department. They receive those results, and a lot of times the health department, best case scenario, will be 24 to 48 hours before we would receive those results, and then 24 to 48 hours to be able to make that first reach out. So in changing up that messaging and just allowing people to understand kind of the expectations of what that process really looks like, our hope and goal in that is that people really would take that ownership of their positive status and then start communicating to everyone that they had been in contact with, during the time that they started symptoms, and communicating, I'm now isolating I have deemed you as a close contact, you also need to quarantine at this point in time. And we do know that that is, extra work that was put on for those individuals, and then also with the employers as well, of hearing that information and then having to take those next action steps. So that's something that we were aware of, but like I said, it was just kind of, we were at that tipping point as far as the number of cases, the number of contacts, and the capacity that not just our health department, but all health departments across the state, as well as the state, where we had hit. I'm not quite sure if I answered the part that you wanted me to take a stab at, Jim, or if there's more.
Yeah, and I think the other part of that question was, why is there a variation from what the state is saying and what locals are saying? And I guess I'm hoping there's not. I mean, we've always been in coordination. Pardon me? We've always been in coordination. The recommendations for the length of time for isolation and quarantine have always been prescribed by the CDC, which obviously the states all adhere to, and we adhere to as well. I think that later on, or just recently, the length of time for quarantine was adjusted by the CDC. And people need to remember too that this is an evolving phenomenon, and we're going to garner more research is being done every day. So we're garnering information to make informed decisions and to modify decisions, and that's not uncommon in this world. That we I'll use another example. The therapeutic drugs that are used now are much different than the therapeutic drugs that were used in the beginning of the pandemic. So we are seeing less fatality, but we're seeing more cases too. So, we improve over time, and that's the way a good health system should be working.
So one final question before we wrap up today, and we will, for everyone whose questions did not get answered in the chat box, we'll be sure to send those on to Jim, Vern, and Lindy to see if we can get some answers for you. But how do people stay up to date with the news that the health department is putting out? Where can we find you? Are there email lists we can sign up for? What's the best way to stay in the loop?
Go ahead, Lindy.
That's a great question. So the best way, we do not have an email list per se. We do send out communications to our community partners via email, but the best way to stay in the loop, I would say, is, of course, I'm assuming Southwest Michigan First has email lists for all the businesses. We send all of our press releases, all of our information for community partners to help disseminate out. I mean, I think that's kind of the key part that we play here at the health department, is that we know it's just not us doing this work. We know everybody, all of our community partners have been helping us, have been working in tandem with us to get that information out. And when we know that information, we are fast to act on that information. This is a quickly evolving pandemic with new information coming in and constantly. And so as we move and adapt, we heavily depend on our community partners to help us get that information out. So that's one mechanism, I would say. Another is our website. We work really hard to get that updated. There is some delay there, as well as you all know who have websites, that you can't act on it as quickly as you can social media. And so social media is the last one, I would say. Our Facebook and Twitter, more so our Facebook page. A lot of times we go live on that page where we do direct interviews with Jim or our medical director, Dr. Nettleton, and then we bring in a variety of community partners as well. So those are kind of the three areas I would point to, of our social media, our Facebook page, our website, and then being in partnership with Southwest Michigan First, as they're a critical partner in helping us get that information out to one of our sectors, which is the business sector in our community.
Awesome. Thank you all so much to Lindy, Jim, and Vern for sharing. We did put the link for First and 42, which is our newsletter that we send out multiple times a week. And anytime we get a press release from you all, we are sharing that in that newsletter. So thank you, Lindy, for giving us those updates. And again, thank you to Jim, Vern, and Lindy for joining us today and for all the information you shared with us this morning and for answering the questions we had. So before we go our separate ways, I did want to share some information about the newest grant program from the Michigan Economic Development Corporation. It is called the Pure Michigan Small Business Relief Initiative and will utilize Federal CARES Act funding to provide $10 million in grants to meet the urgent needs of Michigan small businesses impacted by the COVID-19 virus. The link for the grant has been posted in the chat box. Please make sure to read over the eligibility requirements carefully before you apply. Applications will open on December 15th at 9 a.m. and will be reviewed on a first in, first basis. So the sooner you get your application in, the better your chances of getting this grant funding. And then for those of you who have businesses located in the city of Kalamazoo, there is also the Kalamazoo Small Business Health Protection Grant. Applications opened on December 7th, so that's a few days ago. And this grant allows for a reimbursement of up to $2,500 for expenses, including PPE or personal protective equipment, and other costs incurred in pursuit of the general preservation of health and human safety. Expenses must be dated from April 1st, 2020 into present, and we have posted the link for this grant in the chat box as well. So our next Small Business Series call will take place on Friday, January 15th. I will be sure to send out an invite to everyone on today's call. My contact information has been shared in the chat box, so please feel free to reach out with any questions. Thank you again to Blue Cross Blue Shield for sponsoring the series, and thank you all for joining us today. We look forward to seeing you on future calls. Have a wonderful weekend and a happy new year. Thank you.